Hi, this is your tutor, Nurse Judy. If this is your first time on this channel, welcome to Essential Nursing. But if you are a returning subscriber, we're happy to have you back. Today, we're going to be talking about acid-base balance. This is a topic many nursing students struggle with because it can be very confusing, but I've got you. Let's dive in. For this topic, there are three components to look out for. The levels are checked in arterial blood gases, that is, ABGs, and they are the pH, the PaCO2, which is the partial pressure of CO2, and bicarb. Below are the normal ranges in a perfectly working condition. The pH is normally between 7.35 and 7.45. The PaCO2 is between 35 and 45 millimeter of mercury, and the bicarb is between 22 and 26 milliequivalents per liter. An imbalance in these levels points to either a respiratory or metabolic disturbance. From basic chemistry, we know that a lower pH indicates increased acidity, while a higher pH suggests alkalinity. The pH helps determine if the imbalance is acidic or basic. However, elevated or decreased CO2 suggests a respiratory diagnosis, whereas abnormal bicarbonate levels indicate a metabolic origin. This leads us to the helpful acronym ROME. And who doesn't love a reason to think about Italy? ROME stands for Respiratory Opposite, Metabolic Equal, meaning when the pH and CO2 are moving in opposite direction, you have a respiratory situation. But when the pH and the bicarb are moving in the same direction, you have a metabolic situation. Now, let's put this into context. If the pH is less than 7.35 and the CO2 is greater than 45, we have respiratory acidosis, that is abnormally low pH and abnormally high CO2. But if the pH is greater than 7.45 and the CO2 is less than 45, then we have respiratory alkalosis. Remember, respiratory opposite. If the pH is less than 7.35 and the bicarb is less than 22, we have metabolic acidosis. But if the pH is greater than 7.45 and the bicarb is greater than 26, then we have metabolic alkalosis. Now, let's talk about respiratory acidosis. What are the causes? Hypoventilation. Patients are not breathing deeply enough. It may be as a result of COPD, sedation, or airway obstruction. It means these patients are retaining CO2. They are not breathing deeply enough to expel enough CO2. The pH is low and the CO2 is high. They are saying they can't catch their breath, and then the CO2 builds up. What are the signs and symptoms? Confusion, drowsiness, shallow breathing. What do you do as nurses? You want to maintain airway, you want to administer oxygen if necessary, and you want to encourage deep breathing. Now let's go to respiratory alkalosis. What are the causes? Hyperventilation, which can be due to anxiety, pain, fever, and things like that. In these cases, the pH is high and the CO2 is low. These patients are losing too much CO2 from loud breathing. It's the opposite of acidosis. What are the signs and symptoms? Lightheadedness, numbness, tingling. What do you do as nurses? You have to slow down the breathing. You can use the paper bag technique if appropriate. This will help them retain CO2. You can also show emotional support as nurses. Metabolic acidosis. Causes of metabolic acidosis are diabetic ketoacidosis, renal failure, diarrhea. In these cases, the pH is low. The bicarb is also low. Too much acid from diabetic ketoacidosis. What are the signs and symptoms? Kussmaul respirations, which is the lungs' effort to restore pH by hyperventilating. Also, these patients may be confused and they will definitely be weak. Nursing interventions. You treat the underlying cause. For example, if it's DKA, which is diabetic ketoacidosis, you administer insulin. Then you monitor the electrolytes and administer bicarbonate if severe. Metabolic alkalosis. The causes of metabolic alkalosis are vomiting, diuretics, antacids. In this case, the pH is high and the bicarb is also high. The signs and symptoms are nausea, tremors, muscle cramps. As nurses, we try to stop vomiting by giving antiemetics like Zofran. We can also replace electrolytes, especially potassium. Then we monitor the ABGs. This brings us to the end of this video. Please don't forget to take the quiz at the end of this tutorial to test your knowledge. Please like, share, comment, and subscribe to support our YouTube channel. Also, you can turn on your notification bells to be notified every time we post a new video. Watch out for our next video on respiratory and metabolic compensations. Thank you, and see you next time.